Hello, everyone. Welcome to another episode of Take Back My Brain. I'm your host, Laurie Hammer, and today I have with me Dr. Achina Stein. She is a functional psychiatrist, and I am so honored to interview her today because I had the pleasure of being on her podcast. What If It's Not Depression? So, if you want another podcast to follow, What If It's Not Depression is an amazing podcast. I loved being on there. Like I said, she is a board certified psychiatrist. She's been in practice for 30 years, and she's going to tell us her amazing story. But she has a functional mind practice in Providence, Rhode Island, where she practices functional medicine combined with psychotherapy. And she is a beautiful doctor on a mission to eradicate depression and anxiety from this world. So, Dr. Achina, thank you for being here.
Oh, thank you for having me, Laurie. It's great to see you again.
Awesome, awesome. So I want to know your story. I mean, we talked last time, but I don't know a ton about you. So tell me how you got to where you are, because I know it's going to be great.
Oh, yeah. Wow. It is a story, that's for sure. So, back I've been a psychiatrist since graduating from residency in 1994 and practicing conventional medicine, basically, or conventional psychiatry. I worked in community mental health centers and prison centers,
Mhm.
and really seeing the chronic and persistent mentally ill population.
Yeah.
So really sick people. And I've even worked on the inpatient unit for geriatric psychiatry for a few years. I liked moving around,
Yeah.
um, getting different experiences. But in 2010, my husband was on sabbatical, and we decided to take the kids out of school and travel to India for a couple months, and then France for a couple months. And there was a day where my son became acutely depressed, had a tiff with his brother, which wasn't a big deal. And then before I knew it, he was gone from our two-bedroom studio apartment. And I
Oh,
saw from the corner of my eye that he was literally outside on the ledge of this fifth floor
oh
story
my
building,
goodness. Wow.
ready to jump. Yes, pretty scary. I got him to come back in, and long story short, he, started to have just overnight these symptoms of depression and anxiety, and wasn't able to sleep at night. And the biggest symptom that made me think that something seriously wrong with his brain was the fact that he couldn't read anymore. And we
Wow.
didn't know why. So once we got home from France, I immediately got him to a psychiatrist and had him, seen for and evaluated. And he was seen for psychotherapy because he was
Hmm.
his friends. He was at an age where, he was having some friendship issues, making friends. And
Sure.
so, yeah, so the medications helped to sort of not make him suicidal anymore.
Right. Which was good.
Yeah, which is good. But he was just not the person that we knew. I mean,
Yeah.
and he ended up being on 4 medications
Wow.
very quickly. Yes. So, and he had multiple diagnoses, and very, very quickly. And he was kind of like, for lack of a better word, a zombie.
Uh-huh.
And I just like, this is not acceptable. And so I had him see multiple doctors. Nobody could tell me what was going on or why. I mean, the person who saw him for his difficulty reading said he had double vision, but couldn't explain why. And they just gave us exercises to give him with his eyes. I
Right.
mean, but what is going on here?
Well, especially
Something.
if it happened overnight.
Right. And so, sure, we had a history of, on both sides of the family, of having depression. And, so I was literally told, like, well, be thankful that it's just one of your 3 children that has now probably a lifelong illness, since you're given your family history. And it's like, oh my God, no. So, yeah, anyway, serendipitously, at the same time, I was actually seeking more education around alternative methods of treating mental health. And I had looked at Dr. Weil's program, and I was just looking at different programs, and I had never heard of functional medicine until someone told me about it. And so I found a doctor locally, and I always tell everyone his name. His name is Edward Levitan, and they have a practice called Five Journeys in Massachusetts, Boston, and I think Newton now. But at the time, it was Visions Healthcare. And so he saw my son, and using the functional medicine approach, found that he had celiac disease. He was severely malnourished because all he ate was white food. He had
Sure.
texture issues, didn't eat hardly any vegetables. The only vegetable he had was broccoli, but ate pasta, rice, popcorn, all the white foods,
Yep.
uh, lots of sugar too. So um, all his life, he had severe constipation, severe eczema. Within a month or two, I'm forgetting my timeline a little bit, but he basically had a complete resolution of the eczema and
Amazing.
constipation.
Mm-hmm.
So when he saw that, he was gung ho, like, oh my gosh, I'm gonna,
Mm-hmm.
because he'd lived with that, with the embarrassment of having to,
Sure.
people waiting for him whenever we went out at restaurants, like, got to go to the bathroom because we're gonna wait here for you instead of
Right.
waiting outside, like just a lot of, and just all of the, how his hands looked. I've told him he was
Mm-hmm.
part dinosaur when he was 4 years old. That's how bad he looked, just
Right.
to, he loved dinosaurs at the time.
Mm-hmm.
So it was really a big change for him just to have those two things resolve. But we did a full gut restoration, and he essentially came off of all four medications
Wow.
within a year to year and a half. Yeah.
Nice.
And the problem with his eyes was diagnosed as double vision. And basically he had so much inflammation in his body that it caused inflammation of his cranial nerves that
Sure.
move eyes back and forth. So he couldn't accommodate. Yeah,
Mhm.
really.
Right. Right.
Yeah.
No amount of exercise was going to fix that inflammation.
No,
No.
no. And so that got better. And actually he actually couldn't take his driver's test for another year because it took that long
Oh, wow.
for for that to resolve.
Mm-hmm.
So yeah, I mean, so when a person sees that happen as a physician, like, you can't go back to conventional medicine.
No.
I shouldn't say I can't go back. I just had to learn functional medicine. And
Mm-hmm.
so I did learn it. I got certified in it, and I was hired by Dr. Levitan to work at
Huh?
Vision Care. And unfortunately, they had to close their practice in 2015. And that's when I founded with my business partner, Sally Davidson. She's a nurse practitioner and in 2016, Functional Mind. And we're in Providence, Rhode Island, and that's all I've been doing. So I don't, I'm not anti-medications. They're
Mm-hmm.
still part of my armamentarium, part of my toolkit. It's just that I use them a lot less because people who seek me out are the ones who have failed medications, have had multiple side effects medications, or just can't tolerate, they can't
Right.
tolerate them, or they don't work well enough. They've been on the medication merry-go-round, as I call it, or polypharmacy. It's just, they're just not getting better, and they wanted to try something else.
Right.
So that's what I do. I'm your psychiatric detective to figure out what your root causes are, and I get your body back into balance. And it takes work. It's really, unfortunately, it's really for those people who are willing to do the work and are able to function enough, to be able to do the work and have the supports to help that person, depending on how
Right.
sick they are. So that's where, when you can't function, or if you're desperate and suicidal, then you really do need some medication.
Yeah. Mm-hmm.
Get to the place where you can function and be able to do this work. So I always tell people when they do functional medicine that they really need to stay on the medications, while they're doing this work. And then, once they're well, then we can work on tapering and discontinuing if needed, or if warranted, or if it's recommended. If
Yeah.
I they're I mean, there's been occasions where I've said, no, you really need to be on medication, and
Right.
these are the why. I'll explain why. So,
Hmm.
and then, a lot of times people are pretty satisfied when once you actually explain why, they really should, stay on certain medications. So I'm in there with them for the long haul, and, at their side and trying to figure it out for them.
Yeah.
With
Oh, that's great. That's such a great story. So let's talk about a little bit like what is depression? What is anxiety? And why are we so quick to medicate it if there's definitely some underlying causes?
Well, so yeah, that's a broad question.
I know.
So yeah, so depression and anxiety are symptoms. And the reason we are so quick to medicate it is because a number of years ago, they were considered miracle treatments. People have to remember that there was a time where people were put away in an asylum
Hmm.
and left, like literally left there. There are
Yeah.
places in Africa where people are chained to a tree, to keep them safe because there was no medication. And so medications were a godsend. So the thing is, though there was a time, that was a time where we didn't have all of these issues of our food being contaminated, the number of chemicals that we're exposed to. We've had so many exposures that cause inflammation in our body. There's so many root causes that in those days weren't necessarily there to the degree that it is
Sure.
now.
Yeah.
And so to answer the rest of your question, um it's part of the problem is the way the system is set up. We have a system that in order to treat the masses, and there still are not enough mental health professionals to even treat
Yes.
the people who need to be treated. And so there needed to be a system in place in order to address the issue of treating depression and anxiety. And so the DSM, which is, and there's multiple editions, the Diagnostic Statistical
Hmm.
Manual, that provides diagnoses, and that if you meet the criteria for a specific diagnosis and you are severe enough with those symptoms and can't function or have significant distress, that you can take a medication to address those issues. And that is one solution, and psychotherapy is another solution. That combination has research to support improvements. And it's something that has been a big part of our system. It's easy
Right.
and
It's covered by
requires
insurance.
it's covered by insurance. But unfortunately, it is they consider a treatment to be successful if you have 50% improvement,
Right.
right? And
Right.
that's just not okay,
Yeah, that's not acceptable.
It's not acceptable. So optimal mental health is not the goal. And when it comes to it's a complete suppression of symptoms is not the goal. So unfortunately, that is what is considered the standard of care right now. And lots of people are given medications even if they don't meet those criteria.
Right.
So I think medications are appropriate if it's severe, moderate to severe, and moderate to severe depression or anxiety. But for mild symptoms, I think there are so many things and there's so much research to
Hmm.
support it. But unfortunately, pharmaceutical companies don't pay for conferences where doctors get trained, and doctors depend on their training by going to CMEs, which are sponsored by pharmaceutical industries. You really have to seek out alternative conferences, and sometimes those conferences don't offer CMEs.
Right.
And it really is driven by a particular physician or practitioner, medical provider's interest,
Right.
right? It really
Right.
comes down to their interest in it and desire to offer other treatments, which require time to be able to talk and administer those treatments. So talking about lifestyle takes a lot of time. That's why my sessions are 2 hours, and I have a health coach and a nutritionist on my
Yep.
team. And my follow-ups are an hour, because it takes time to discern all of the possible root causes from the beginning of life that is attributed to your health, and it requires having an index of suspicion of your exposures and
Yes.
having conversations. It takes time to pull apart the complexities of a person, which is not provided, or it's not. And if it is, well, I shouldn't say that. There are codes for it, but then they're not paid for. Like,
Right.
there's actually codes that you can use to send to your insurance, but then the insurance declines to pay.
Right. Right.
And so it's kind of set up, but it's not enforced, and it's not, it's just needs to have we need to have improvements in this area. There needs to be more, and there are. The beauty of this is that since I started in 2010, more and more and more people know
Yeah.
about functional medicine. They seek functional medicine.
Mhm.
There are more doctors that are, and nurses and PAs and are becoming functional medicine providers.
Right.
So it's really, really wonderful. And we're also noticing it in the changes, let's say on the menu in the grocery store. So
Hmm. Hmm.
food is not a fad.
Right.
There's
Right. It's a real
no,
thing. It's a real
it's a
thing.
real thing, because it's there are people who have immunological reactions. It's
Yes.
not just a food intolerance or a fad.
Hmm.
There's serious immune reactions to gluten. And so, I mean, I can go on and on and on and on
Right.
and
Right.
talk about these
Well, I'd
things.
like to dive into a little bit of the gluten issue there because your son was diagnosed with celiac disease. Um, I was diagnosed with celiac disease. I had depression and anxiety. I see a lot of my clients who have a celiac diagnosis that also have depression and anxiety. In your, functional psychiatrist practice, do you see a correlation in those two things often?
Oh yeah,
Yeah.
often. Yeah, often. I mean, celiac disease is an autoimmune disease. And it's not just celiac, it's all the other autoimmune diseases,
Hmm.
especially Hashimoto's and Graves and lupus, that have significant depression and anxiety.
Yeah.
But 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 it's due to increased gut permeability, aka leaky gut.
Leaky
And
gut. Hmm.
yes, there's thousands of papers on this, that emerging research in the past 10 years. It used to be thought that leaky gut was quackery, but now we have
Right.
so much evidence that shows leaky gut, since Dr. Alessio Fasano's research uh,
Hmm.
that has been published. Um, so it is an immune reaction, an autoimmune reaction, but there's also other ways that people react to gluten. So it's not just celiac disease. Gluten causes an increase in zonulin, which by itself can cause increased gut permeability. But there's also non-celiac gluten sensitivity, and
Hmm.
different ways. And there's other ways too that that we're not even talking about,
Sure.
that's more complicated, but that where you can react to gluten. So it's really important to understand that it's not just one test that you draw. It's really looking at multiple factors that gluten can impact your gut as well as your brain
Yeah.
ultimately.
Absolutely, absolutely. I think people are becoming more aware of this factor and hopefully they're accepting it more and not thinking that all of us are a little bit nuts. So, yeah,
Right.
yeah,
Yeah, absolutely. Yeah, it's really important to change the diet when it comes to finding root causes. We call it unmuddying the water, unmuddying
yes.
the to really find all of the factors and really do whatever we can to reduce inflammation. Sometimes we can put those foods back in at some
Hmm.
point. Really, the top two would be gluten and dairy in
Yeah.
my mind. So for some people, it's more than that, but ultimately, it's really those two, especially when it comes to the brain. But it's also adding as many vegetables as you can, eating healthy fats, eating enough protein, but not too much fat, you know?
Right,
Yeah, so you want to find the right balance in terms of diet. But
right.
ultimately, it's really getting rid of the sugar, the
Hmm.
chemicals in our foods, the ultra processed foods and snacks. Just removing sugar and processed foods makes a huge difference for people.
Yeah, definitely. Especially for kiddos, I just, if even if you're just going to keep it super simple, just don't buy anything in a package for your kids, just feed them real foods and don't, not even taking out all gluten or all dairy. I've had a lot of kids, they're like, their teacher's like, what did you just do? Over this last week, like he can sit still in school now. And it's a big deal. And ADHD, ADD, all of that is brain related, and usually there's a food component, driving that,
Mhm.
unfortunately. So we can change a lot with the diet. That's not usually the end all be all to everything. So I would love for you to talk about what are two other, bigger upstream causative factors where, root cause issues that really affect depression, anxiety, and brain health.
Sure. I mean, I use what I call the shift protocol.
Yes, talk about
That's
that.
really 5 root causes. So SHIFT stands for stress, hormones, infections, foods, and toxins.
Hmm.
And so we talked a little bit about the foods, and I mentioned toxins, and there could be toxins in foods, but there's also toxins in our environment. There's a lot of toxins indoors, that if you don't necessarily open your windows and you're sort of in this vacuum sealed
Right.
house with air conditioning and heating and rarely air out your home, you're going to be surrounded by VOCs, all sorts of like flame retardants. There's cleansers that people
Hmm.
have that use a ton of. It's amazing how many cleansers people use in their homes. There's
Right.
so things that are, and then there's really mold toxin illness that a lot of people might be living in and not realizing how it's impacting their body and their brain. You can have severe depression
Hmm.
from mold illness.
Yes.
Um, then there's chronic infections. I've diagnosed people with severe major depressive disorder, and just again, having an index of suspicion and really looking at the history and getting details of the history, figured out like, I really think you have Lyme's disease. And
Mm.
sure enough, because it just didn't make sense for it to
Right.
be the root cause. I mean, we're in an endemic area for Lyme.
Sure.
And so it's higher on the list, I
Right.
think, compared to other places. And so, sure enough, it was Lyme's disease. And when we treated it, the depression went away.
Right.
So, but there are other types of infections besides Lyme. There are other tick-borne illnesses,
Mhm.
Bartonella and Babesia. Babesia can cause severe anxiety and rage. But there's Ehrlichia and Rickettsia, there's Anaplasma. So it's good to get those treated. You could have a tick-borne illness and not have
Not-
Borrelia, which is
Yeah.
Lyme. But there's also H. pylori, there's dysbiosis, there's SIBO. These are all connected to the gut. And anytime there's a dysfunction in the gut, you
Hmm.
have dysfunction in the brain.
Yes.
Absolutely.
100% of the time. Yeah.
Yeah. So people have associated anxiety, for example, with IBS and depression too, with
Hmm.
IBS, irritable bowel syndrome. And they've always believed that the IBS was due to the anxiety. Well, guess what? I typically see it the other way around, that people might have a concussion that would shock their vagus nerve and shut their gut down. And then
Yes.
they would have IBS types of symptoms, and then 3 months later, they would have anxiety.
Yeah.
I see it
Yeah.
again and again because I do a timeline of all the patient's symptoms, and you could see, okay, here's your perfect storm, and then
Hmm.
boom, boom, you see it over and over and
Over and
over.
over again. Yeah.
Yeah,
Yeah.
it's amazing. And so it's really helpful to do your own timeline to help connect the dots.
Yeah.
And I really think it's helpful to put your entire history on a timeline.
I
And
agree.
it would be either age, put your age, the year. It's even more helpful if it's month and year, and then the event.
Mm-hmm.
And it's putting psychological events,
Yes.
biological events, social events, and functional, any changes, any testing, and sometimes when two or three things happen in a particular time period very close together, I call that your perfect storm. And
Right.
a lot of times it's downhill from there. So your immune system is working really hard for you to manage all of this, all of these things that are coming at you. And at some point, it's just like, uncle,
Right.
for me,
No.
crap. So usually people can figure out when they crashed, and like they can
Mm-hmm.
look and pinpoint it. And then you ask, well, what happened before then? Oh, I had mono for 3 months. And, you
Right.
know,
Right.
yeah. And the doctors told me it had nothing to do with my symptoms of how I'm feeling now. It's just like, oh boy.
Oh, I know. I
But
know.
your titers are sky high, all four of them. You're reactivate, like, so it's looking for those things.
Yeah.
Uh, so some of the things that I just mentioned, sometimes people will go to their doctors or their medical providers, and say, I'm not feeling well, and they have blood work done, and oh, well, all your blood work was normal,
Yep.
but the only things that they really test for is a CBC, a comprehensive metabolic panel, which is primarily your liver and your kidneys and your electrolytes. CBC is a complete blood count, a TSH, maybe a lipid panel,
Maybe.
maybe B12 and folate, maybe a vitamin D, and they just look at that. And if they're within normal range, even if they're slightly off, they might not be in optimal range. So normal range doesn't necessarily
Right.
mean optimal for you.
Optimal. Mm-hmm.
Yeah. Well, I just mentioned a whole bunch of tests that, given what is provided in the history, I will order,
Mm-hmm.
and sure enough, I get positive results at some point, and then we create a
Yep.
plan to
Yeah.
address these things. So I would not accept, find out what the testing was, and find out there's a whole bunch of tests that we can do, and I do a whole comprehensive panel for functional medicine to find multiple root causes,
Right.
and as well as a stool test and a urine test. So it's really important to test, and lots of providers say test, not guess,
Yeah.
and,
Yep.
and figure out what they are. So people are not walking around with just these heads. They have
Mm-hmm.
bodies attached to them, and
Head to
so
toe.
information, in their body, it's going to absolutely affect your brain.
Yeah.
Absolutely.
100%. 100%. Yeah.
Yeah.
Oh, I know. I know. So you
Yeah.
have a really special project going on because you are so passionate about this, and I'm really excited to hear more about it. It's the Healing Depression Project. So I want you to go into that, please.
Yes. So the Healing Depression Project, if people want to look for it, it's www.healingdepressionproject.com. And it is going to be a breakthrough program. It's going to be a serious paradigm shift in the field of mental health,
Awesome.
where we are doing a 4-week program using the functional medicine approach, along with lifestyle changes that are basically taught. It's like a training program, but with testing, where we teach people lifestyle changes in an intensive program, where you're there for 30 days, and you're like 360 kind of
Mhm.
evaluation, and finding what your root causes are, but then working towards teaching you how to cook, how to move your body, how to
Wow.
meditate, how to breathe, psychodrama. There's all sorts of things that will be teaching you how to habit stack and creating a program specifically for you.
Wow.
And then you are followed up once you leave the program and go home. That program is integrated into your lifestyle for 2 weeks. So you'll have daily follow up for 2 weeks after that. Uh,
Wow.
yeah, presently. So Sylvia Cavelli is the founder and CEO of the program. She basically has an incredible history of having 20 plus years of depression, and she did absolutely every program on the planet and ultimately created her own program because she had gotten well, but it didn't last, and
Okay.
or
Hmm.
wouldn't get well and get somewhat well, 50% or 75%, but it
Hmm.
wouldn't last. So she ended up creating her own program and found that doing multiple things stacked one on top of the other on a daily basis really was what resolved
Okay.
her depression. And she's been depression free, I believe, for 5 years now, and she
Amazing.
basically has made it her mission because she was able to do it for herself to really provide an opportunity for others to do it. And so we are really passionate about it. We are looking for 15 participants. There is an application that people can apply for. There is scholarships that will be available for them.
Great.
um, and the program starts on August 30th,
Okay.
2024, and we want 15 participants, I believe, by July 30th. So uh, please let everyone know
Yes,
about this.
we will.
Uh,
Hmm.
so it's going to be in Texas, Austin, Texas,
Okay.
and it's going to be amazing. And we are doing research to prove that the functional medicine approach, I mean, our goal is to prove
Yes.
that the functional medicine approach is really equal or better to medications and longer lasting ultimately,
I love
you know,
it. Yeah.
long lasting results. So we're sure to have follow-ups at some point beyond this participation as
Oh,
well.
that's great. That's great. And it's so needed in this world. We need those extra studies just to, you know, kind of what I want to say, filter out some of the mainstream stigma that's surrounding functional medicine.
Right, right. And even depression, it's
Yeah,
not calling it weakness.
absolutely.
It's
Yeah.
not a weakness, and it's not something to be ashamed of or embarrassed about, right? It's
Right,
it's
I
a
know, always teaching it, there's always a root cause issue and, we fix the deficiencies, get to the root cause issue. And, I get to see people all the time overcome their anxiety and depression. And they were told they're gonna have to be on their medication forever and ever. So I
right.
love the work you do. You're doing amazing things. I appreciate you so much. Thank you for being part of this world. Is there anything you want a final thought you'd like to leave with the audience?
Well, for some people, they may not be able to change their life by coming, let's say, into this program.
Hmm.
Sometimes there's things that get in the way. Always have hope. There's always someone out there that will help you, like yourself.
Yes.
You can always, if you wanted to dive into more of a functional medicine approach for yourself, you can. I wrote this book called "What If It's Not Depression? Your Guide to Finding Answers and Solutions." It's an Amazon international bestseller, and you can get it on Amazon.
It'll be in the
And
show notes, everybody.
yeah, and I've had people let me know that they did everything that I recommended in the book and they got better. So,
Awesome.
and there's so many things that you can do that are free. Really.
Yes.
There
Yes.
really
Love it.
is. And so it's really putting your mind to it, believing that you deserve it, believing that you can do it, and that there is a future for you. And there is hope for having joy for the rest of your life.
Absolutely. Thank you, Dr. Tina. I really appreciate you. Thank you all for listening, and I will see you in the next episode.
Thank you so much.